Hi everybody, I'm back with another video about social work. Excuse the beeping if you hear it. It's my smoke detector and they have yet to come and change the batteries on it. But anyway, I wanted to do another video about preparation for the license exam, and I want to talk specifically about bipolar disorder. We as social workers and aspiring social workers should be using person first language. So what that basically means is you want to define the person before you define the disorder when you are speaking about a person or a group of people. So if you wanted to say, I work with bipolar disorder patients, you would not say that. You should not say that. You should say, I work with people who have bipolar disorder. And that's used across a variety of disorders and conditions. Like for instance, instead of saying I work with HIV clients, you would say I work with people who have HIV, or I work with homeless families or homeless individuals. You would say instead, I work with people who are homeless or families that are homeless. So it's all about getting your language right so that you make the person feel as if they are a person and not label them with the condition or the disease. So bipolar disorder, and I do have my notes, so I will be glancing from time to time. But bipolar disorder, and a lot of people would just simply call it bipolar. Oh, well, he's bipolar, she's bipolar. The correct terminology would be he has bipolar disorder or she has bipolar disorder. It's not just bipolar. Um, Bipolar disorder causes a person to have drastic moods. You know, some people joke and say, oh, well, I can't deal with her because she's so bipolar, or I can't deal with him because he's so bipolar. And they are really just normalizing a serious condition, and making fun of a serious condition when, people who are bipolar or people who have bipolar disorder, it's very serious. They go from one extreme to the other. And, we know people who can be, a little iffy and up and down. But a person who has bipolar disorder, you know that they have bipolar disorder. They go from being extremely high, extremely high, all the way down to being extremely low, just like that. And they have some normal moods in between. But I mean, when you're extremely high, they call that mania. Maybe having a manic episode. And then when they're extremely low, that's called a depressive episode or depression. So when someone, and a good movie, y'all, to watch is Call Me Crazy. That's one of the best movies I've seen to describe bipolar disorder, depression, PTSD. Like, it's on Netflix. It's a very good movie if you want to see a good portrayal of these mental disorders. But bipolar disorder the onset is usually around your 20s, early 20s, and it can happen even earlier than that. But once it occurs, it normally happens throughout your lifespan, and it seems to run in families, and some people even believe that it's inherited from family members and things like that. But there's no known cause for bipolar disorder so far, but it is very treatable with medication, and a lot of people have it. A lot of people have bipolar disorder. About 2 million Americans have bipolar disorder. And, the onset, again, is very early. It's very rare that it happens, after the age of 60. So, what is it like to have overly high feelings and be in a manic state of mine. Um, Normally, and I see this on my job, I'm a victim advocate, and I've read reports where people have called in missing persons, and they are looking for their family member who thinks, well, in addition to having bipolar disorder, they have some paranoid ideation and things like that. So, they've called in missing reports for family members who have, they think that the government is watching them. They think that, you know, the antenna on the TV or the antenna on the car is somehow picking up signals from a satellite in space, and they have to get away, and they think that people are listening to their conversations on their cell phones and things like that. And then, they may drive clear across the country, and they may spend up all this money and, swipe debit cards. But that's when you have dual diagnosis. But I want to stick with just the bipolar for right now. But the mania it usually lasts for about 2 weeks or so. You have high energy, you're just high on life, you're excited. I mean, super, super, super excited. We know people who are excited about life and, that are just jolly every day and fun loving and easygoing. But these people, when they're in mania, they have, high energy. They can run, they don't have to sleep. High sex drives. They engage in risky behavior, being promiscuous, drinking a lot. Again, they don't need to sleep. They believe in unrealistic powers and have very grandiose ideas and things like that, where they believe that they're unconquerable, they're invincible, they're on top of the world. They may abuse drugs or alcohol. Again, like I said, they may drink a lot. They have a high, and it's like, no, there's no stopping them. They just have so much energy that they're just up, 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 where you kind of just look at them like, goodness, shouldn't you be tired? That kind of thing. They're extremely irritable and intrusive, and sometimes they engage in offensive behavior. So those are some of the signs of someone who who's in a manic episode of bipolar disorder. Now, on the other end of that extreme is the depressive moods, where the person may feel hopeless, they may feel worthless, but it's not like the normal, oh, I'm just feeling blue today. I don't want to get out of the bed today because it's raining, or, I'm just feeling like I need a break from work. I've been working 70-hour weeks. I just need a break, and, I just need a mental break, a day off. It's not like that. It's where you are so down in the dumps that you can't get out of the bed. You can't get out of the bed. Not that you don't want to get out of the bed, but you just can't. You can't see anything good in your future. You may feel guilt about something. You may feel hopeless. You may feel worthless. And these are serious feelings. Depression is a very serious illness, and people write it off as if it's just nothing because they feel like you're just sad. But it's more than that. It's more than just being sad. And, people write depression off because a lot of people have it, and it seems so common. They call it the common cold of mental illness because so many people have it. But it's a very serious disease. People, when they're in these depressive moods and who have bipolar disorder, they may not have any interest in anything that they normally do. They just don't feel like doing anything. They may have a decreased sex drive. They have a decreased energy level, and they just feel slow physically slow, dragging. They have a lot of sleep disturbances. They have difficulty remembering things and concentrating on things and focusing on things. And it's just like it's like being sad to the 20th, 100th power. No, it's not a word, but it's like being so down. They may lose weight, they may lose their appetite, or they may gain weight and eat a lot. It's just a feeling of emptiness, just persistently sad or anxious or restless, and just feeling gloomy and hopeless. And I wish, like, I've never experienced depression, a diagnosed depression. So I can't even really tell you how down in the dumps you have to be, like, where you just, I mean, I have been down in the dumps before where I felt like I was maybe having some temporary depression, but it definitely wasn't diagnosed. Maybe I had an episode, after a very, very difficult breakup. But I mean, I felt like I didn't want to live anymore, but I wasn't suicidal. But still, it's like, it's just being so down, but you just came from being so far up. So it's like polar opposites, like this extreme to that extreme, just like that. It's just like that. So let's see if I'm leaving anything out. Okay. So with bipolar disorder, of course there is treatment, medication, of course, is a treatment, counseling, CBT therapy, cognitive behavioral therapy. It's just, let's see, I don't want to give you any incorrect information. Electroconvulsive therapy is another treatment for bipolar disorder. So it's a very serious illness, and people use the term loosely. Oh, he's bipolar, she's bipolar, but it's very serious, and we should treat it as such. And as social workers, we should be knowledgeable about it. As social workers, we should know a little bit of everything and have a specialization in something, because you want to be very well-rounded. You want to know a little bit about everything and a lot about something. That's how I see it. So if I can help, if you have any questions, if you want me to do a video on any particular subject with social work or the exam, please let me know and I'll be happy to make it. I'll do the research and give you the information to help you out, because we need more social workers in the world, and we need good ones, and we need honest ones, and we need we need people with good character, morals, and values, and people who can treat other people with dignity and respect, and give people the choice, because social work is all about giving our clients self-determination. So if you have any questions, leave them in the comment box, please, and I'll be happy to get back with you. So until next time, we'll see you later.